Hey, I'm Dr. Kent DeLay. I'm a board certified urologist in South Carolina. And today I'm going to talk a little bit about evaluating an employment contract or an employment situation, mainly from a financial perspective. I just want to back up and caveat this with I am not a lawyer. I don't have any special technical expertise in evaluating contracts for physicians, but this just comes from my own experience of having been through two jobs prior to the one I'm in now, looking in detail and comparing positions. And I want to try to give you a little bit of the background that I've learned and what I think is helpful in evaluating these situations. So let's just back up and say there are a lot of varieties of compensation models for physicians, but they really break down into a few models. Today I'm going to focus on what employed physicians will see and how it might relate to money in their contract. And this is just to give you a brief overview of what I've learned looking through the process. So there are some situations where people are paid by a straight salary. Here, you get a defined amount of money per a defined amount of work, usually X dollars per year. And in theory, physicians in these types of environments are less likely to drive up costs by doing unnecessary procedures, et cetera, to drive their reimbursement. Mayo Clinic, Cleveland Clinic use models like this. But the bottom line is in today's healthcare environment, dollars in and dollars out matter to all systems. So you have to bring in value for your salary. There's a lot of different ways you could do this: teaching, research, administrative duties, and clinical activity. But the main way doctors generate revenue is clinical activity. So in some ways, there's going to be something tied to production in the way that your future is shaped. Usually you are expected to meet a certain RVU threshold, but even if you aren't directly paid per production, most physicians in these situations find that there is an incentive to produce because future raises, et cetera, are often at least partly influenced by clinical activity and the amount of money you're bringing in. Show me the money! So while there may be less direct pressure in the short term, that doesn't mean you're totally kind of disentangled from financial considerations. But in the short term, the advantages would be less production pressure and probably less competition amongst partners since you're less directly tied to production in the short term. Some disadvantages: there's obviously going to be less financial upside, and usually by putting you on a salary, the institution has to directly control you a little bit more to make sure they are getting their value in such ways as controlling your clinical templates, as well as vacation time being watched very closely. You get X number of days and you can't really go over that, while physicians and production models find they often have a little bit more leeway. So pure production, here you're paid directly for the work you do. So usually in most employed environments, this is measured in work RVUs, and WRVUs are something that a lot of physicians look at, but in employed environments, this is often directly how you're paid. There are situations where some physicians are paid based on collections, even in employed environments, but this is a little bit different in that you're literally looking at dollars in, dollars out, and how that difference directly relates to your income. This is more of the private practice model where you're thinking about cost, et cetera. And in an environment where you can't really control cost, this dollars in, dollars out model doesn't make a lot of sense. So work RVUs are the main way that physicians are paid in employed environments. Now, there are a lot of considerations about how this would work out. So the first thing people often want to ask is, well, how much am I paid per RVU? And while this is certainly important, it's not the only consideration. And so we're going to talk a little bit about what some of those other ones would be and what you need to really ask. So you do need to know what's called the multiplier, which is the number of dollars that you get per work RVU. This varies by specialty, varies by region, varies by type of environment, and even directly is tied to payer mix in some sense, in that if a system has a really poor payer mix, they're not going to have the income to give you a higher work RVU per unit of work, so to speak. So things to consider when you're looking at work RVUs. What is the efficiency of the environment? And this can be tied to a lot of things, such as support staff, scribes, the EMR. All of those things affect how efficient you can be. And so you want to make sure that that is on the higher side of efficiency if having a higher income. So you've got to make sure the system has the ability to get you the resources you need to be efficient, and then that's a priority for them. So that's one consideration. Another is the number of patients to be seen. Uh, in medicine these days, with the shortage of physicians and providers in general, usually not a huge issue, but you want to make sure that there is a demand and need in that environment so that you have the number of patients you need to see to generate the number of RVUs you want to meet your financial goals. Another consideration, something that gets even a little more complicated and almost political depending on your environment, is within your practice, how are patients split up? So particularly in older private practices, this model of where primary care doctors will often refer directly to Dr. X because I know Dr. X. So if Dr. X has been in the community for a very long time, he may get more referrals, meaning that those patients disproportionately go to him. And so how many patients are available to be seen by a new physician might be impacted. Now, a lot of times in employed environments and big systems, it's just a referral to a service line, whether it be general surgery or urology or whatever it may be, but something to ask and make sure that you're going to have access to the number of patients you need to see. Okay, so all of that said, how do you evaluate these things? I mean, a little bit of it is just sensing the environment, asking a lot of questions when you're there, and snooping around. But I really think it's important to ask for data about how the production is going for the physicians currently employed. So in every job environment I've gone into, I have asked for the production data. It's usually de-identified, so you're not saying that Dr. Jones is producing this, but it's de-identified. So you see what the physicians are producing and their number of work RVUs. And I think, there's always a spread, but you definitely see some systems where they cluster to a lower range and some systems where they cluster to a much higher range. So to get a sense of what you will be able to produce, I think is very important to have this data. Also, if you're a procedural specialist in today's environment, are you going to have access to procedure space? Are you going to have access to OR time to be able to do what you need to do to produce? So another consideration that has become more acute lately. So there are other kind of hybrid environments that aren't entirely just flat salary versus production, where you may have a base salary and then bonus on top of it. But generally, in most environments these days, people are either salaried, which is the minority of situations, or you have a situation where your production is going to affect your income pretty directly. So money obviously is not the only consideration. There are lots of other things to think about in a job: quality of life, call coverage, the community, the cost of living in that community. All of those things are important. But from a financial perspective, really need to understand these models. Am I going to be salaried? How would that salary change over time if I am going to be salaried? And two, if I am going to be tied to production, how can I get a sense of what this production potential is? And like I said, it's really important to ask for data from the system before you would take a job, because if you don't, you may be surprised with what the production potential is when you get there. Hope you find this video helpful. I'm always glad to answer any questions posed directly to me, as I've learned a lot through this process, and hope it helps you.